Hello, everyone, and welcome back to Root Cause CSI. I'm Joan Lu, your functional medicine practitioner, and in this podcast, we explore health conditions the way investigators approach a case by examining them through multiple clinical perspectives. Before we begin today's episode, I want to acknowledge that March is both Women's History Month and Endometriosis Awareness Month. Women's History Month is a time to recognize the strength, resilience, and contributions of women across generations. It is also an opportunity to reflect on areas where women's health has historically been under-recognized, understudied, or sometimes misunderstood. Conditions like endometriosis remind us why these conversations matter. For many women, symptoms such as severe menstrual pain, fatigue, digestive changes, or fertility challenges may sometimes be minimized or dismissed for years before answers are found. Raising awareness is an important step toward improving understanding, research, and compassionate care. So, in recognition of Endometriosis Awareness Month, today's episode will focus on understanding endometriosis from multiple clinical perspectives. As always on Root Cause CSI, we will examine the condition through three lenses: the conventional medicine perspective, the functional medicine perspective, and the traditional Chinese medicine perspective. Each lens interprets the same condition differently, and when we examine them together, we often gain a deeper understanding of what the body may be experiencing. But before we begin our investigation, I would like to briefly share why this topic is personally meaningful to me. Like many women, my own health journey included experiences with PCOS and endometriosis. At one point in my life, I was told by physicians that pregnancy would be impossible for me. I was also told that if pregnancy did occur, it could result in miscarriages. Hearing those words can be very heavy, especially for women who hope to start a family one day. During that time, I began learning more deeply about nutrition, lifestyle, and the ways different medical systems interpret women's health conditions. I made changes in my daily habits, including my diet, physical activity, and overall approach to supporting my health. Over time, my body responded differently than expected. Today, I am grateful to say that I became pregnant and now have a son. I share this story not as medical advice, but simply as a reminder that every person's health journey is unique and that understanding our bodies from multiple perspectives can sometimes open new ways of thinking about health. This experience is one of the reasons I became deeply interested in integrative and functional medicine and why conversations about conditions like PCOS and endometriosis are so important to me. Now, with that context in mind, let's begin our investigation. So, recognizing the pattern, before discussing the medical frameworks, it helps to recognize the patterns of symptoms that many individuals with endometriosis experience. For some women, the earliest sign is severe menstrual pain that begins before the cycle starts and may continue throughout menstruation. The pain can sometimes radiate to the lower back or thighs. Others experience pelvic pain outside the menstrual cycle, discomfort during intercourse, or pain during bowel movements around the time of menstruation. Heavy menstrual bleeding, irregular cycles, and persistent fatigue are also frequently reported. Some individuals notice digestive symptoms that appear cyclically, including bloating, nausea, or abdominal discomfort. In other cases, endometriosis is discovered during fertility evaluation when pregnancy does not occur as expected. Because these symptoms overlap with other conditions, diagnosis can sometimes take years. This is why examining the condition through different clinical frameworks may provide a broader understanding of what may be happening within the body. Now, let's begin with the first lens. From the conventional medical perspective, endometriosis is defined as a condition in which tissue similar to the lining of the uterus grows outside the uterine cavity. These growths, often referred to as endometrial implants or lesions, are commonly found within the pelvic cavity. They may appear on the ovaries, fallopian tubes, pelvic lining, or surrounding tissues. Like the uterine lining, these tissues respond to hormonal signals during the menstrual cycle. Each month, they thicken and attempt to break down. However, because they are located outside the uterus, the inflammatory material cannot exit the body in the usual way. This can lead to localized inflammation, scar tissue formation, and adhesions, which may contribute to chronic pelvic pain and sometimes fertility challenges. Diagnosis in conventional medicine often begins with clinical evaluation and imaging, such as ultrasound or MRI. However, the most definitive diagnosis typically involves laparoscopy, a minimally invasive procedure that allows physicians to visualize the lesions directly. Treatment, tre- Treatment approaches they usually offer include pain management strategies, hormonal therapies that suppress ovulation, or surgical removal of endometrial implants depending on the clinical situation. From the conventional lens, the primary focus is on the physical presence of endometrial tissue outside the uterus and the inflammatory effects it creates within the pelvic cavity. Functional medicine approaches the condition by asking a slightly different question. Instead of focusing only on the lesions themselves, functional medicine asks what internal physiological environment may allow this condition to develop or persist. Several biological patterns are often explored. One of these involves hormonal balance, particularly the relationship between estrogen and progesterone. Estrogen stimulates the growth of endometrial tissue, and when estrogen activity is relatively higher compared to progesterone, tissue proliferation may be more pronounced. Another area of interest is chronic inflammation. Excuse me. Many individuals with endometriosis show elevated inflammatory signaling, suggesting that immune system activity may play a role in symptom development. Functional medicine practitioners may also examine gut health and the microbiome. Some researchers describe a group of intestinal bacteria known as the estrobolome, which influences how estrogen is metabolized and recycled in the body. The liver also plays an important role in hormone metabolism and detoxification, which is why liver function and detoxification pathways may be evaluated when examining hormone related conditions. Other factors sometimes explored include metabolic health, environmental toxin exposure, stress physiology, micronutrient status. All of these factors may influence inflammatory pathways and hormonal balance. In this framework, the focus shifts from identifying the lesions alone to examining the systemic internal environment of the body. Next, traditional Chinese medicine, often referred to as TCM, interprets endometriosis through a completely different framework. Rather than focusing on hormones or tissue growth, TCM evaluates patterns of energy flow and circulation within the body. One of the most commonly described patterns related to endometriosis symptoms is blood stasis. In TCM theory, blood stasis occurs when circulation becomes impaired or stagnant. When blood does not move smoothly through the body, pain can occur, particularly during menstruation. Another pattern that may be observed is liver qi stagnation. In traditional Chinese medicine, the liver system is responsible for maintaining the smooth flow of qi or vital energy. When this flow becomes restricted, it may contribute to emotional tension, menstrual irregularities, and pelvic discomfort. Some individuals may also present with patterns described as cold accumulation in the uterus, which in TCM theory may slow circulation and contribute to menstrual pain. Within this framework, the focus is less on structural abnormalities and more on patterns of balance, circulation, and energy flow within the body systems. When we step back and compare these perspectives, we see three different interpretations of the same condition. Conventional medicine focuses on the physical lesions and inflammation within the pelvic cavity. Functional medicine examines systemic physiology, hormones, inflammation, metabolic health, and environmental influences. Traditional Chinese medicine evaluates patterns of circulation, balance, and energy flow within the body. Each lens highlights a different aspect of the body's response, and sometimes when these perspectives are considered together, they help patients and clinicians better understand the complexity of what the body may be experiencing. Endometriosis continues to be an area of active research, and many questions about the condition remain under investigation. What is important is recognizing the symptoms such as chronic pelvic pain or severe menstrual discomfort should not simply be dismissed as normal. The body communicates through symptoms. Understanding those signals is often the first step toward seeking appropriate care and support. If you found today's episode helpful, consider sharing it with someone who may benefit from learning more about endometriosis and the different perspectives used to understand it. And if you would like to hear more discussions examining health conditions through conventional, functional, and traditional Chinese medicine lenses, be sure to follow Root Cause CSI Clinical Scientific Investigations. Until next time, keep asking questions because every symptom has a story and every story has its root cause.